Hi, my name is Maggie Lyon, and this is a nutrition-focused physical exam. Today we're going to be working from the head down all the way to the calves, or the gastrocnemius. And I'm here with my esteemed colleague, Patrick, who's going to be volunteering for this. So, I have received a weight loss pathway consult where I saw in the charts that the patient has lost 10 pounds over the course of 1 week, and I'm going to go into his room and we're going to discuss that weight loss and conduct a full nutrition-focused physical exam. Okay, so we're going to start from the top. Knock, knock, knock. I've come in. Hi, Patrick. I saw in the chart that you've lost some weight over the past week or so. Could you just tell me a little bit about that?
Yeah, just really don't have much of an appetite.
Okay.
And yes, you know, my clothes are fitting a little looser, having to tighten the notches on my belt.
Okay. Could you just verify your name and birthday for me?
Patrick Dalton, November 26, 1984.
That's exactly what it says in your bracelet.
All right.
All right. So now I just want you to verify a few things. How tall are you?
5'11".
Okay, and what would you say your usual body weight is?
About 170.
Okay, and we have it in the charts that you're around 160 today. So you have lost about 10 pounds over the course of 1 week.
Right.
If that's okay, I'd like to do a nutrition-focused physical exam on you. Basically, I'm just going to look for fat and muscle loss throughout your body. The whole thing is going to take maybe a few minutes. Is it all right if I perform that on you?
Let's do it.
Okay, fantastic. So I have some gloves in my pocket that I'm going to put on right now. Okay, so I've put gloves on, I've sanitized my hands before I've done so, and now I'm going to start at the top of Patrick's head. All the while, what I am going to be doing is not only assessing for fat and muscle loss, but I'm also going to be checking for his skin turgor, the color. I'm going to take a look at his eyes, see if there's any jaundice. I'm also just going to be checking the integrity of the skin, whether or not there's capillary refill in the nails and the skin, and just other notes throughout the time that we're together. So I'm going to start on your temples. So what I'm doing is I'm just going to palpate here. Will you just take a couple of bites for me, please? Big ones? There you go. Okay. So here I'm just testing for fat and muscle loss. Those feel good. The next thing I'm going to be doing is palpating underneath his eyes for his orbital fat pads. So I'm just lightly palpating under the eyes, just checking to see if I can feel bone, just making sure that those feel like they have a little bit of give. The next thing I'm going to do is I'm going to have him swallow. Have you had any difficulty swallowing or eating?
No.
Okay. I'm just going to ask him that beforehand, but what I'm going to do is I'm going to place my hands just under his throat, right here. I'm going to ask him to take a big gulp for me. Ideally, we'd be doing this with a glass of water. The next thing I'm going to be doing is just moving down. I'm going to go and look at Patrick's clavicle here, and clavicle region and the acromion. Typically in males, not always females, we're not going to have so much clavicle definition, but in his case, we don't really see too much, but in females, it's a little bit more distinguished. So what I'm going to do, if he was wearing a gown, I'm just going to move that gown over, and I'm just going to feel in here into the interosseous tissue. And this feels really good. You can see, I can feel the bone, but it's definitely padded with fat and muscle, and it feels all right. The next thing I'm going to do is I'm going to feel for his shoulder squaring, if that's something that I was worried about. What I'm going to do is I'm going to cup his shoulder, and I'm feeling for his deltoid. I'm also feeling for that acromion bone right there at the end of the clavicle and making sure that that isn't squared. Here I'm checking for musculature and basically just making sure there's no protruding bones or bone prominence. So this feels really good. Now what I'm going to do is I'm going to check Patrick's tricep for fat and muscle loss. If you just don't mind just raising it for you can actually just keep it forward right here. And what I'm doing, we're going to keep his arm at a 90-degree angle, and I'm just going to separate the skin from the adipose tissue or the musculature. And in this position too, I can check for musculature. I can see if there's any loose skin. He's got a great arm. You can put that down. The next thing I'm going to be checking for are the interosseous spaces in the hand. What I'm going to have you do is if you just make an okay sign for me. Okay, great. I'm going to have you just move your hand down just like that so I can see it. Basically, I'm looking at the dorsal part of the hand, the top of the hand, and I'm just checking to make sure that there's some musculature in the thenar pad. And then I'm also checking the top of the hand to make sure that there's still muscle and tissue in there. Sometimes in patients that are malnourished or very elderly, you start to see the bones and there's very little musculature and the skin is very thin. All right, thank you very much. Okay, I've had my subject de-gown because what I want to do is take a look at his pectorals. I want to take a look at the interosseous and interstitial areas of the ribs, and then I also want to take a look at his back and the musculature, especially in the scapula area, the trapezius, and the latissimus dorsi. So what I'm going to do is basically the same as all the other parts. I'm just going to feel his pecs and make sure that there's ample musculature there. Feels good. And then what I'm going to be looking for here is making sure that I can't see the patient's ribs. But if I can, that's an indicator of malnutrition. The other thing I'm looking for when the patient does not have a shirt on, I'm able to examine their upper body more fully, is the prominence of the iliac crest, which would be right here. You cannot see the iliac crest on Patrick right now, but it would be there and it would be protruding should he have substantial fat and muscle loss. So what I'm going to ask him to do is just move to the edge of the table. And then I'm going to take a look at his back and the musculature and the scapula. So if you don't mind holding your hand out like this, okay? So he's going to extend his whole arm fully. So I'm just pressing against his hand here just to give it a little bit of give. And then what I'm doing is I'm just feeling behind the scapula. You can also have the patient hold a wall or something other, like the head of the bed that's firm. I'm just going to be looking here. I can feel that this has substantial musculature and substantial fat padding, or adequate fat padding, I should say. The other thing I'm looking for here are his trapezius and the latissimus dorsi, that there's ample musculature covering the posterior rib cage, and there is. Okay, and the last part of the nutrition focused physical exam is more lower body. So what I'll do is I'll ask the patient to look at their legs, usually if they're in bed, from underneath the covers. The first part, what I'll be looking at is the gastrocnemius, or the calf muscle. And what I'm looking for, same as the others, is I'm looking for the skin turgor to be all right. I'm also looking for ample musculature. I find that the legs are very telltale for malnutrition. Patrick has ample musculature here. I can see that his skin is firm and intact. I can also see that he has ample padding for his muscles. So to do this, basically what I'm looking for is just for them to have a 45-degree angle, so the calf would normally just hang loose. All right, and now one of the last pieces is to look at the quadricep and the knee. So if you don't mind just putting your leg all the way down. So what I'm looking for in the quad, I'm just gonna raise his shorts just a tiny bit. Again, same as the gastrocnemius, I'm looking for musculature. I'm making sure that there aren't striations where the skin has hung loose for massive fat loss or massive muscle loss. I'm also making sure that the knee has ample padding and that it isn't, there are not a lot of bone protrusions. So yeah, that will really conclude the nutrition-focused physical exam.